Mariana, first of all, thank you so very much for joining us today. I'm so excited to have you as part of this podcast. I was just looking at your background, and you're obviously incredibly accomplished, and I know you'll be very humble. But maybe you can tell us a little bit about yourself. I made a list of questions which I'll go through afterwards, but I'd love to hear your background.
Perfect, of course. Thanks for having me today, Lauren, and nice to meet you here virtually. So my name is Dr. Mariana da Silva Jardim. I'm an immigrant from Brazil. I came to Canada in 2019, and I recently finished my family medicine residency at the University of Toronto, where I also serve as chief resident. For the past 3 years, I've been working at ITPO, Internationally Trained Physicians of Ontario, which is an NGO that advocates for foreign trained doctors like myself to help them navigate the system into the Canadian healthcare system. And I've been serving as the vice chair at ATPO for the past 8 to 9 months.
Wow, fantastic. That's incredible. Well, congratulations. Absolutely amazing. So I'd be curious, because you probably have an amazing perspective on this. What's your current take on the current healthcare crisis in Canada? Like, if someone were to ask you about it, what would you say?
So that's a great question, actually. I think there's a different points of view that we can take on that. I think one of the ones we see as the biggest one is the human resource crisis. So we have physicians, especially primary care physicians, they're working not seeing comprehensive family medicine, they work in specific fields. So patients are not being attached to family doctors as often, and that's creating backlog to specialists. That's creating longer wait times in emergency departments because of one crucial component, strong and well-supported primary care. So I would say for what we've seen from the crisis happening right now, I believe it's linked with our primary care has been left to the sides for a while, and you need to take that back to the center of the discussion.
Yeah, that's really interesting. So why is it that you think there are, it sounds like there's an incredible talent pool of internationally trained physicians. Why is it that it's so difficult in Canada? Like, why is it so hard? It sounds like they'd be a key part of the solution to help solve the crisis from a capacity standpoint.
Absolutely, because a lot of these physicians are already in Canada, right? They are landed. You don't have to recruit them abroad. They already know about the system. They're already integrated in the communities. They could definitely be a great resource. I think one of the biggest disconnect is there is no link or no integration between the migration process and becoming a physician in Canada. So once a physician migrates to Canada, they have to go through this pathway by themselves alone without much support and without actually knowing how the pathways work correctly, I would say. For example, myself, when I migrated here and I connected with the immigrant organizations, they kind of didn't know what to do with my skills in Thailand. And they kind of suggested me to go through other healthcare professionals as ultrasound technician or even personal support workers. Again, that's very needed in the healthcare system, but it was not the skills I had and the way I would like to support the systems themselves. And there was no actually available job for me as someone who was not able to license as a physician in Canada. So I think there's a big disconnect about what the immigrants can do once they arrive in Canada, and how the pathways work and how the people can be informed of how they can maintain their skills while they're here and how they can enter the pathways properly, because there's a lot of barriers, especially for those who graduated many years ago, that I would like to go and explain later on about those barriers, which is a big pool of immigrants already in Canada. Many immigrants that are here have experience for 10, 15 years. But when they're here, they're not able to use that to any clinical skills used on a daily basis.
Yeah, that's so unfortunate. I actually have some colleagues that were trained internationally as well, and similarly, they just seem very frustrated as well. And so if I were to ask you, what are some of the barriers? Like when you're coming from another country and you are so well trained as you talked about, and there isn't any guardrails or guidance on what to do and where to go next, what are the barriers, aside from that, what are the barriers that a internationally trained physician would face? Like, are there additional costs, are there additional education, residency, all those things?
Absolutely. So the barriers is actually the pathways themselves. So first of all, professional medicine is regulated by colleges, as I'm sure you're aware, and provincial and national colleges have their own criteria of who can become a licensed physician in the country. Unfortunately, those criteria are very narrowed, usually accepting just training, specialty training or family medicine training from specific countries. For example, the College of Family Physicians of Canada only accepts family medicine training from UK, Ireland, Australia, and USA. All the other people trained in family medicine or who have worked as GPs in other countries or trained as GPs and family doctors in other countries need to go to different pathways, which are very restrict and mainly account for two main pathways: the residency match, meaning retraining as a family doctor or a specialist, or a practice ready assessment program, which is again has its own barriers. So I would say the criteria for people to enter the system are a big barrier. And the main two ones are years since medical graduation. So we do know that, for example, entering in residency training in Canada, the year you graduated is important because they tend to prioritize those who graduated recently. And some programs even put in the descriptions that they don't accept applicants who graduated more than 3 to 5 years ago. The other barrier is recent of practice. So most of these pathways, residency and program assessments, they wanted to have current clinical skills, and that's understandable. But that can be really hard for physicians who already migrated to Canada because they've been trying to get in the system for many years, so they lose the recent of practice. So it's really hard. So to circumvent those barriers, some physicians even go back and forth to their home country to keep the clinical practice updated, which is really difficult. They have families here, they have jobs here. How are they going to maintain themselves in Canadian dollars if they are earning in their country currency? So, all those barriers create a hard time for physicians being able to apply and then to enter those pathways.
Yeah, it seems so sad and so counterintuitive, just given the fact that I think I read 6.5 million Canadians are without a primary care physician. And if you look at some of the data, it looks like over the next 10 to 15 years, it could be 1 in 2 Canadians won't have access to a family physician. Is the problem, or is it similar for nurse practitioners and other folks as well? Or is it just germane to practicing doctors?
So our organization and my main knowledge, I would say about doctors that will come and physicians that are coming to Canada. I cannot speak about how it works for nurse practitioners. One thing that I do know is that nurse practitioner is not a role that exists in most countries. I, for example, have never heard about that role and that position before I came here. So even some doctors are going back to training to go, because nurse practitioner, they can, some places in the US, you can go through a training with some things recognized by medical school. So some doctors even go back to training to work as nurse practitioners because as a physician it would be harder.
Wow, that's so crazy. And so what's the guidance? Obviously, with your pedigree and your profile, you're probably an amazing resource to internationally trained physicians that want to come and practice in Canada. What type of guidance do you provide them then when they come here? Like what's the best thing that they can do? Where does it start and where does it end in terms of trying to circumvent the system, but expedite the system so they can practice here more readily and faster?
That's a great question. And I have lots to say about that, but I'll try to summarize some things. First of all, I think I would like to emphasize how important it is to focus on using the pool of physicians that are already in Canada. I know there's a lot of immigrant physicians skilled elsewhere. They love to come to Canada, but we already have a lot of them here. And I think to prevent having more immigrant physicians coming and not being able to work, one key thing is having newcomer organizations working with those prospective immigrant physicians right away from the process. For example, most immigrants come to Canada through the economic pathway, which is you get points based on your curriculum, your CV, and years of practice. So you have all these skilled immigrants who work 10, 15 years as physicians coming here, and they think if they give me benefits of joining the country, they're going to give me benefits to working on there. And that's not true. So these newcomers organizations, they need to be at the point, at the same time as the immigration process starts, saying, hey, might take a while for you to work as a physician. These are the things you can do. These are the pathways available. We need to figure out together which ones you apply to and how we can work starting with that. So we need immigrant organizations right away helping the physicians understand the pathway, because I'm going to be honest, it's really hard to get the information properly. When I came here, I did a lot of research before I came. My partner is Canadian. He helped me out. But once I arrived, I realized that I only know like almost nothing about the whole process. So having a clear and transparent website and organizations that are aware of them right away is super important. So, and at the same time, that will help them prevent long delays on their journey as immigrant physicians here, because they already know what the next step should be and how I access the next step. That way it won't take them 3, 4, 5 years to start applying to residency and programs assessments. That won't make them lose the currents of practice. That will help them continue to stay updated on their clinical skills. So I would say one of the biggest things to prevent and help the physicians is make sure that newcomer organizations are prepared to take these physicians in, and they know how things work, and they can help physicians right away.
Yeah, so I have a bit of a controversial question I have to ask you. And so I've read some of the articles in the Globe and Mail, the Toronto Star, just online around this notion of there's some discrimination on the residency side, especially for internationally trained physicians. What would be do you agree with that, first of all? And then secondly, why do you think that is? And then what can be done to correct it?
That's a great question. And I would say I agree. I think there's a system bias against international trained physicians, especially those who are immigrants. So we usually don't like to make the distinction, but ITP, so international trained physicians, are constituted by two main groups. One is those that did a medical degree and migrated to Canada after that, and the other is from Canadians that went to study outside of North America, also known as Canadians studying abroad. So if you see the match rates for a residency, you see that most people that match are from certain countries. They did medical school in certain countries, like UK, Australia, and Ireland. And it's known that the Canadians who are studying abroad are mainly on those countries. So you would assume that those are the people that they are accepting more to the programs. And that's actually what we see. And I think there's different reasons for that. I think, first of all, these people know they would want to come back to Canada. So they are able to secure observerships and clinical electives and networking with physicians in Canada to get letters of reference, to get connections that would help them to get into a residency program. The other point is that being Canadians, they're already aware about how the system works and how some things are very crucial and important to get matched into a residency position. And I'm going to give you an example here. Personal letters or personal statements. It's something very common for applying to a residency position or even a medical school position in Canada, but it's something that most countries in the world is not used. I had never heard about a personal statement applying to residency until I came here, so I didn't even know how to write those. And so those Canadians who went to study abroad and came back, they know how to write those. Likely they have reading those before, or they have people who can guide them on how to do that. At the same time, the immigrants don't have that same opportunity. So when you have those two letters, one that is very prepared, one that is what's that used for, and the other one who is not a lack of skills, but they don't understand because it's not part of their system and the culture system. Those are weighted different in the evaluation process. So I think there is different reasons for why there's this discrimination, but one of them is because we are comparing, have this pool of physicians that don't have that much knowledge about how the system works to match, but not about skills. It's about circumventing the system issues that are not giving them the proper resources to be well prepared to a match application.
Yeah, it makes perfect sense. It does feel discriminatory for sure. It's very unfortunate because there's so many talented internationally trained physicians, and it would really help the healthcare crisis.
Absolutely.
Question for you: did you happen to notice there was an article? I think it was in the Toronto Star around I'm just reading my notes where there were 3 Canadian senators had proposed a solution, an expedited solution to the crisis, and they were talking about accelerating the path of internationally trained physicians. And they talked about things like federal government funding to really help accelerate that path. Do you think it's a funding issue primarily at the national level, at the federal level?
I think it is also a funding issue. I think it's a pathway issue as well. So there's a limited number of pathways for a physician to be able to come and work as a licensed practitioner here in the country. So we need to expand the pathways and the opportunities available. But even the ones that exist right now, for example, the practice ready assessment pathway, which takes a physician who is trained abroad and they evaluate them from 3 months and then see if they're able to practice independently or not for a provisional license. So even those, they are, first, their criteria are very strict. Again, they have emphasis in currency of practice. So physicians that are already here are not even able to apply to those positions unless they keep doing the back and forth to their home country. Second, some of them don't accept the types of training physicians have in other countries. For example, in primary care, many countries don't have a 2-year family medicine residency program. Usually they have a 1-year general practice internship, and then they can choose to work as a GP or go into the specialty. And these pathways don't accept this kind of training. Then once these pathways, accepting people, they're only accepting a small number of people. For example, in BC, they have the practice ready assessment for over 10 years, but they're only assessing less than 30 people a year. I'm not sure it's because of lack of funding, because of lack of resources. I'm not sure it's because of lack of physician supervisors, but expanding the pathways with funding usually is probably one of the biggest ways that we can help expedite the use of physician skills in the country, and it's extremely important. But funding is important. It's important also multi-stakeholders approach to this, because it's not about the money, but where the money is going and how it's being used. And if the criteria are actually matching the people that are here wanting to enter the system, it's not about a skill, but what they are seeing as the requirements. Like I said, you can't require a family medicine residency from countries that it doesn't exist. That doesn't mean these people are not skilled. They are just trained differently. Right. They perhaps didn't have 8 weeks of psychiatry rotation because psychiatry was on a daily basis. So you need to adapt those criteria to match the people that are here and they're eager to work in the system.
Yeah, it makes total sense. So I'm curious about your comment on the pathways. You mentioned there's limited pathways. Is it a bifurcated issue, like twofold? Is it not only that there's not enough pathways, but the composition of those pathways are flawed as well because they're almost seem like they're too hard and they take too long and they're too costly? Would it be both issues?
Absolutely. I think the number of pathways, like you mentioned, and how hard it is to enter them and how limited number of people can actually enter them. There's only few spots. For example, practice bed assessment, I mentioned BC was assessing 30 people by year. Residency, family medicine residency, they only have 267 spots for ITPs last year for family medicine. At the same time, there are 1,500 almost ITPs applying. So, there's not many spots and there's not many pathways. We need to create other venues for people to enter the system. One that I didn't mention, it might be worth talking a little bit about, is something that Alberta and Manitoba have been doing, which is called clinical assistant. So clinical assistant role is a regulated profession there that a physician who trained abroad can work under supervision of a licensed physician, but they are more hands-on. They have more, they can showcase their skills. They can work in hospitals. They can work as surgical assistant. They can really work in their field in the area and gain the knowledge of the system. Some of them will stay in their role forever because they like and fulfill them, and that's their goal. But some of them could actually use those pathways to then reach to an independent license. Imagine someone that's been working as a clinical assistant, regulated with a doctor, learning through the system for 3-5 years, and then they are able to have their independent license. So those are things that needs to be expanded. Only Alberta and Manitoba have it right now, but we're hoping to see an advocate for that to expand to different areas of Canada.
Yeah, that sounds really interesting. So as a clinical assistant, and pardon my naivety, so if I was internationally trained
Mhm.
in medicine, I'm not smart enough, but if I was, uh, and I came over to Canada, then I could become a clinical assistant, essentially, in Alberta or Manitoba, and that would usually be, you're saying maybe 2, 3, 4 years in that capacity?
It depends how your contract works. So you are hired by the government, right? We have a contract with the government, and you work as a clinical assistant, which for those who know a bit about the medical profession, works similar to a resident, which you see your patients on your own, you prescribe the patient, but always with the supervision of an independent licensed physician. But you can work in different areas. So if I was trained in internal medicine, I could work as a clinical assistant in internal medicine, and that you can create someone who has the knowledge of the system, is keeping their currency of practice, and they can stay in that profession if that's what they wish. But that could also be used as a bridge. It's still not used in the provinces, but that could be used as a bridge to have this person to have a license independently afterwards, because they already work in the system. They already been proved that they know their skill, they are current in their practice, they are safe to practice, so let's give them a license now. So we believe that's like a pathway that can bridge immigrant coming here to have a practice license independently afterwards. Have in mind that, again, this pathway also has criteria that are very specific, but it seems to be working well in the provinces that they have been in place.
So, as the chair of the Internationally Trained Physicians of Ontario, are you trying to bring that Western mandate into Ontario, like use them as a proxy or an example to say, look, this is a way, it's one of the pathways that we can expedite to get really talented people to help impact the healthcare system in Ontario faster? Is that one of your key mandates?
So that's absolutely something we've been talking about, stakeholders. That's something we write down in our reports. That's something we've been working with another organization called ITPO, with a multiple of organizations with international trained physicians. And that's something we definitely think Ontario and other provinces could take advantage for. And to be honest, BC recently started something called Physicians Associate position, which is very similar to the clinical assistant position. Different names, but similar professional roles. So some provinces are taking small steps to take that into account as a new pathway, but again, very small steps and very slow. For example, 2019 or 2020, if I don't remember exactly the year, I applied for a physician associate position in BC. But then takes too long. I went to residency. I started residency. I finished residency, and I never heard back from them. So things take a long time.
That's crazy. Yeah, I was reading about just some of the barriers. I think I've read, and this is just educating myself on some research, but I had significant delays, bureaucratic red tape, prohibitive fees, exams, clinical requirements, educational requisites, recency of practice stipulations. It just sounds like it's so unfortunate. It just sounds like we're doing everything to hinder rather than help. Because ultimately, I think those that really require healthcare in Canada are the ones that unfortunately are being most implicated, because we've got very talented folks like yourself that we seem to be putting physicians through the ringer and not giving them the proper opportunity because they are so well trained overseas. And so I guess the question I would have for you at a very broad base, if you were running the country and you had the opportunity to change things, what would you do first? Like, how do you think? What do you think is the fairest, most judicious, and most efficient and effective way to fix what feels to be a real unfortunate situation for international trained physicians?
That's a great question, a very hard one to answer with one answer only. I think there's a lot of points in the system that need to be improved to be able to use the skills that this pool of international trained physicians in the country have to be able to help with the crisis we are on. But if I had to point out one, I think I would reinforce the importance of having a bridging pathway for physicians who are here, but they can't work independently, but they're here. They want to maintain their skills. They have skills. They just need to know the system and be able to apply those skills in the new context they are. So creating those pathways, like the clinical assistant pathway, physician associate pathway, and expanding them so physicians can actually enter them in an expedite manner, not waiting years and years here, without their current of practice. I think that would be where I would put my money.
And what type of advice would you give to medical graduates that have graduated from foreign countries and they're coming back to Canada? Like, what should they do when they come back? What's the first thing?
Get in contact with associations that understand the path of a physician in Canada. Sometimes that might be newcomer immigrant associations, but most of the time it is not, because unfortunately most of them don't really understand the path of a physician in Canada. They have a really shallow knowledge of what is required. In their mind, if you pass the exams, you apply for a license and that's it, and that's not the case. You have thousands and thousands of physicians who pass all their exams, but have been trying to get in the system for 5, 6, 7 years, even more. I know people who have applied for 11 years, and they're not able to get in the system. So I think the number one thing is get in contact with organizations that have a clear understanding, and they can guide you and also give you advices about the system. Because a lot of the times it's not about skills, but about knowing how to work inside the system to get into a licensed position, is knowing what a personal letter is knowing how important it is a letter of reference, is knowing how to do an interview, which is a specific type of interview that is done into a residency, which is different than a job interview. So all those little knowledges that is hard for someone who was not trained here to know, but there's nothing to do with skills or knowledge. It's about system understanding. And so you need to connect with those. And those people will be able to guide you and help you throughout the way.
Yeah, it makes perfect sense. And would you, for somebody that is newly graduating and they're coming back to Canada, do you have names of those associations? Like, what types of groups would they reach out to?
So for ours are, for example, so International Trained Physicians of Ontario, and although we have ITPO, and although we say Ontario, we serve the whole country. We have members in all provinces in Canada. And so our organizations, the IMG, Alberta International Medical Graduates Organization, they're also a big one, ITPAC. So usually organizations founded by international trained physicians who saw that it is needed to have a support system to be able to be successful inside the system in Canada, that created these organizations to help others. So I would say these are the biggest, biggest points of contact I would suggest people. And, be mindful that a lot of those times we are talking about personal experience, and there is a caveat to that. Every person has a different personal experience inside the system, but a lot of the times we also work with organizations that can help you bridge your way into Canada healthcare system by creating connections with different networks as well. So I would say get in contact with those people, because also, I'm going to be very honest, Lauren, to get into the healthcare system in Canada can be very challenging for a physician's mental health, self-esteem, economic background, and having the support of people who have been through it makes you stronger, makes you realize you can do this, make you have the right connections, the right support. So I would say getting the support system in place for people who have knowledge, but also the personal experience is extremely important.
Yeah, that's such a great comment. I can just only imagine how frustrating, like you almost have to have some mental toughness, just because we do tend to make it so difficult here. It just seems so crazy. Well, Mariana, you've been wonderful. And first of all, congratulations on your accomplishments. And it's really incredible the work you're doing with the International Trained Physicians of Ontario. It's such a gap right now. And I think it's so great that at least there's some type of remedy if somebody is trained overseas and they need to figure out how to navigate the system. So congratulations to you, and really appreciate you taking the time today. Really great work, and so glad to have you on the podcast.
Thank you so much, Lauren. Thank you so much for having me. It has been a pleasure. I hope everyone enjoys this episode as much as I enjoy being a part of it. So thank you for inviting us.
Thanks, Mariana. Take care and stay healthy.
Thank you too. Bye-bye.
Bye-bye.